Carotid artery stenosis is a blockage of the carotid artery. The carotid artery sits deep in our neck on both sides and is the major blood flow from our heart to our brain. Oftentimes, carotid artery stenosis is asymptomatic, just like patients with high blood pressure. Oftentimes, they don't know they have it until it becomes a problem. Because the carotid artery is the major blood flow to the brain, the symptoms that we experience are numerous, but the most common are difficulty speaking, vision changes, usually in one eye, and then weakness and numbness, usually on one side of our body, either the right side or the left side. And these can be short episodes, or what we call mini strokes, or it can present as a major stroke. Both of these are emergencies and should be evaluated immediately. On the other hand, patients who are not symptomatic, we like to try and identify these patients beforehand. The way that carotid artery stenosis is detected, for one, it can be picked up on physical exam. We can actually place a stethoscope on our neck and hear a swooshing sound, also known as a bruit. More oftentimes, the way that we pick up carotid artery stenosis is with imaging. The most common imaging is doing an ultrasound of the neck to look at the carotid arteries, but we can also sometimes do this with CAT scans, MRIs, and angiography, which gets into which types of patients should have this evaluated to look for this asymptomatic disease. And those are our older patients, patients greater than 65 with any number of risk factors, including patients who have coronary artery disease, patients who have peripheral vascular disease in other places, patients who are smokers, patients who have family history of stroke and TIA. Those are patients that we identify as high risk, and your primary care doctor, your cardiologist, or us as a vascular surgeon might recommend to you to get screened for this. The treatment options for carotid artery stenosis really come into three different categories: surgery, stenting, or a new hybrid procedure that we do. For surgery, the name of that surgery is a carotid endarterectomy. You make a small incision on the neck right over the carotid artery where the blockage is, and we open up the artery, we take out the plaque, and then we usually sew in a little patch to prevent narrowing. For the stenting, we go in through an artery, usually in the groin, and we deliver the stent up to the carotid artery and open up the artery from the inside. And then there is a newer technology called transcarotid artery vascularization, and it's kind of a hybrid between surgical principles and stenting, where we actually make a small incision at the base of the neck, directly access the artery, and then deliver a stent. This type of surgery, it's almost always a one-night hospital stay, and most of our patients go home the very next day. Patients should feel very confident choosing to have their carotid artery stenosis treated here at CHRISTUS Health. We're dedicated to our patients. We're dedicated to a team approach to incorporate not only us as the surgeon, but our staff to make the patient's experience as best as it can be and achieve the best outcomes for our patients.